and just to respond to some of the pressing issues that we've seen also resurfacing in the media. So we are joined here today by the Minister of the Acting Minister of Health, Mamoluko Kubai Ngubane. Mamoluko Kubai. We also have the Deputy Minister.
It's always a pleasure speaking to you, Prof. Diapa de Visser. I beg your pardon, Professor Diapa de Visser from the Dula Omar Institute. For more, we await now to see what happens with the elections. October, February, held over even further. We have to wait for decisions to be made, but they have to be made quickly.
Well, the battle against the COVID-19 pandemic does continue in the country. We're currently under level 4 lockdown, adjusted at that, but to try and cut the spread of the virus, the President is expected to give that address, including this. The Acting Minister of Health, Mamoluko Kubai, expected to give an update of the current status of the COVID-19 pandemic in the country.
Yeah, let's take you live to that briefing now. Our team behind us telling us that it has started. Here is the Friday morning health briefing on ENCA.
A lot of issues raised in that regard, and she will also be focusing more on the effects. And we also are going to hear from Mr. Martin Kingston. Now, Martin Kingston is Business for South Africa Steering Committee Chairperson. He is going to be giving us a sense of the private sector partnerships, what is being done to help government scale up in terms of vaccination. And then we also have, as I've mentioned, the DG, Dr. Abutelezi. He's going to be speaking more on the status of the max vaccination sites as we're trying to ramp up and achieve some of the set milestones. In terms of recent developments, we also have project manager for EVDS, Ms. Melanie Wolmarant, who will be giving us some great news in terms of alternative scheduling. In terms of closing remarks, the Deputy Minister, Dr. Joe Parker, is going to be wrapping our briefing, but before he does so, we will open for Q&A so that the members of the media are able to pose some questions, because I know there's been quite a lot of questions, particularly this week. So I will now hand over to Minister for her opening remarks. Minister, please, you can go ahead. Thank you so much.
Thank you very much, Hlengiwe. Good morning and welcome to everyone who has joined us for this press briefing. COVID-19 infection cases, ladies and gentlemen, continue to fluctuate in waves, and each wave leaves behind bereaved families and lost loved ones. Each day that this pandemic continues to spread and infect more people, it robs our country of its greatest resources, and that is its productive people. In the last 24 hours, there were 14,858 new cases, which is a decrease from previously, where we had a day before, when we had 16,240 new cases. The number of new cases have been on a downward trend. We have also seen a significant drop in numbers in Gauteng, which has been the epicenter of the third wave, that we have seen more numbers actually, and we've always been worried about. Although the 4,988 new cases are still quite high, it is a significant drop from the provincial peak, which went as high as over 16,000 cases per day. The drop in numbers does not mean that we should lower our guard in the fight against this pandemic. Just because the numbers are coming down does not mean the virus has stopped spreading, does not mean that the Delta variant, which is spreading and it is still just as lethal, has stopped spreading. This means that our fight should rather intensify. We must continue to observe actually the non-pharmaceutical interventions by wearing our masks, by continuing to social distance, by continuing to sanitizing and washing our hands with soap. In the midst of fighting this pandemic, KwaZulu-Natal and Gauteng provinces got engulfed in social unrest, or the riots that we saw, that were very disruptive to our social lives, economic lives, and to the healthcare service delivery system, especially more intensely in the province of KwaZulu-Natal. This social unrest have added to the complexity of our fight against the COVID-19 pandemic. Moreover, the violent nature of this protest unsettled the healthcare system as a whole, especially today. Ladies and gentlemen, at the height of the unrest, there were disruptions in all areas of the health system deliveries, in all areas of the health service delivery system. There was a decrease in the number of vaccinations due to closure of vaccination sites. There was a loss of vaccines due to looting. An estimated 120 private pharmacies were destroyed, which led to a loss of approximately 47,500 vaccine doses and loss of damages to the infrastructure that supports the healthcare system as well. Fortunately, or which would be something, because I think it could be as well unfortunate, but we can account that large majority of public vaccine sites were not damaged, and this actually enabled us to resume the vaccination in the province of KwaZulu-Natal as quickly as you have seen with the numbers that we have started reporting. Today, we have visited the province to engage with the provincial health in KwaZulu-Natal in order to better understand the extent of the disruption and to find ways to quickly restore normality to the system to the extent that it is possible. In Gauteng province, just to zoom in as well, there was minimum disruption in the healthcare system. Vaccination numbers, yes, dropped slightly due to the people fearing to go to certain vaccination sites that were close to nature of the protest. But all indications show that we have been able to resume quickly, and that's why during the week we could be able to reach the numbers that we saw. And I need to indicate that the disruption that we saw is not only to the vaccine program. We get reports that people who are on critical and chronic who needs chronic medication, people who need regularly to visit hospitals and clinics were unable to do so, which this meant that it put their lives at risk more. So continuous engagement with communities as they do their protest, which is their democratic rights, it is important for us to continuously engage and appeal that whatever we do, we should never compromise the lives of South Africans by disrupting the healthcare system. All indication, ladies and gentlemen, are that we have passed the peak of the third wave and the overall number of cases have started to decline. However, we are cautioning and we are extremely worried because the many gatherings that we saw during this unrest in the two provinces, namely Gauteng and KwaZulu-Natal, may lead to another surge in numbers. So we'll continue to watch the situation closely, and that we need to be able to ensure that we screen in these communities, we test in these communities, firstly appeal to those who were in those gatherings to actually try and ensure that they present themselves to the nearest health facility should they feel that they have symptoms that could portray that they are actually showing symptoms of COVID positive, because we are worried that some of them are likely to stay away because in the contact tracing, people are expected to give indications that this is where I have been, and people, because of fearing of being arrested, are likely to stay away and not go and test. And we really want to urge all the community members to say, please, we appeal to you, if you've been in those protests, if you've been in those gatherings and you see yourself or you are presenting with particular symptoms that are related as well to COVID-19, please present yourself so that you can test and protect your families, you protect your communities and your loved ones. We equally as well in the process, because we do note that based on my interaction this week with the correctional services as we were launching the vaccine program, we did get an indication that quite a number of the people who were arrested as they were presenting themselves to the correctional services or where they were put in correctional services tested positive of COVID-19. And we were comforted that there is actually an isolation mechanism or quarantine mechanism that has been put in place by correctional services that does not allow for those who arrive at correctional services to infect those who have been inside. And that is an indication, one of the indications that shows us that we need to be concerned about those who have been in the protest. Coming to our vaccination program. Our vaccination is gathering pace, and we are thankful to South Africans who have responded positively to the calls to go out and vaccinate. The number of vaccinated people has just surpassed 6 million yesterday. It is a milestone for us. We are quite excited about, but we do note that in terms of our population, we are still very low. Also this week, so the rate of vaccination per day rising to 250,000 per day. Though yesterday we dropped, but we are confident that we will see our target being reached, which is 300,000 per day in terms of vaccination in the coming week. The milestone we have achieved in the vaccination program are as a result of a very productive and coordinating working relationship between government and private sector, the contribution by all healthcare workers, our vaccinators, our data capturers, people who are assisting us in the queues. We are very happy, and I want to say a special appreciation to the team, including those that are working behind the scenes to ensure that things are working very smoothly. The private sector, through the Business for South Africa platform, is working very closely with government to bring vaccine to the people. Through this collaboration, we have also been able to bring into the vaccine program 1,500 volunteers, who include doctors, nurses, and healthcare workers broadly, to help us to vaccinate on weekends on various sites across all 9 provinces. Mr. Martin Kingston from Business for South Africa will elaborate on the partnership with private sector and their role in the vaccination program. We think this is a very critical and important partnership. And most of the time, because we've been talking about what we are doing in government, we felt that it is important that we showcase that one of the things that we've learned in dealing with COVID-19 is to be able to work together as South Africans, be able to prioritize what needs to happen for South Africa and for South Africa. We are putting additional systems in place to ensure that we vaccinate at an even faster rate than we are today. We have agreed with the Solidarity Fund that there should be mass vaccination sites in all metros across the country. This is to cater for the larger population densities that are found in the metro municipalities. We believe as well this model will assist us to increase the pace and the numbers in terms of vaccination. The team is here today to be able to explain in detail, to give us details in terms of this mass vaccination sites. As we continue to vaccinate, we are making every effort to streamline the administrative process so that there's ease of use of the IT system, the EVDS, and the access to physical sites, vaccination site. We continue to listen to your feedback as you give us through social media, through your call to our call center, through your emails, through interacting with our vaccinators on the ground. And that's why most of the time you see the improvement in terms of our systems, in terms of how we operate, in terms of how we implement this vaccine program. One of the things that we've been getting as complaints about the automated scheduling process, which at times was allocating people to sites to which it is costly for them to access, or even places that they do not know. In this regard, we are happy to announce that we have changed or reprogrammed the system to allow for self-scheduling. This means that anyone who is registered can choose a vaccination site where he or she was vaccinated. To ensure that we reach all South Africans, we are working on ensuring that the registration web portal website uses all 11 official languages for ease of access. So far, isiZulu, isiXhosa, Sesotho, and Afrikaans have gone live, and we are still working on other languages so that we can be able to, even those who are Tonga, Chivenda, Siswati, Sindebele, will be able to get their languages very soon. Ms. Melanie Wolmarans has joined us to give more details on these changes on our EVDS system. Yesterday, we presented progress to the Inter-Ministerial Committee on Vaccine and have agreed with our proposition to do away with sectoral prioritization in our approach to vaccination. And I need to indicate this is because we are finding it more tedious, more administrative in terms of the work, and it takes us and takes the team in terms of focus, in terms of making sure that you do a lot of administrative work over time. Lead time is almost like a month in terms of preparing a sector. So from now on, the age-based strategy will be our approach going forward. It is more effective and it helps us to reach a wider spectrum of South Africans. And as we have committed to say, we'll start zooming into districts, into provinces to ensure that there's equitable vaccination across the country. The vaccination of the over 35 has been going very well. I know that we said when we announced previously that we announced that we are registering and will open on the 1st. The national group, as they are commonly known, or the breadwinners, many have called this group with names that sometimes they say it's the so-called let's do coffee generation, have not waited for the 1st, actually presented themselves to the sites and have started to vaccinate. One of the lessons that we are learning is that when you say registration and vaccinate later, it doesn't seem to work. We have encouraged that the sites where they are able to vaccinate them, they continue to vaccinate them. But we also have encouraged them to say, please prioritize the 60 plus in terms of our vaccination program, because we would want to ensure that the 60 plus population, which majority of them are the frail senior citizens, do not arrive at a site and have to queue long hours in order for them to get their vaccination. So part of what we have done now, we've developed protocols to ensure that the walk-ins in the sites are more clearer, and this was approved by the Interministerial Committee yesterday. Since just like any other medication, the side effects, different individuals will experience the side effects differently. Some less severe, some more severe, and there are those who say they did not experience any effects. However, we are concerned that there is a growing spread of fake news as well, and false narrative that is starting to make people feel uncomfortable to vaccinate, with more and more issues around vaccination side effects. But again, we are encouraged by those who are sharing their experiences, how they've been able to be guided by the healthcare workers on the sites, the information that they've been presented. But also, again, we want to continue to urge people, as you present yourself to vaccinate, please be honest and share your medical history so that you can receive more advice and proper advice on our vaccination program. Some of the stories actually have started to discourage people from vaccinating, but also others are deliberately creating panic around the vaccination program. We continue to monitor this and we provide feedback where we pick up these issues, but we also urge South Africans who have experienced the vaccination program and have stories, especially positive stories to share, but those who have also negative stories in terms of the side effects, to continue to share with us and register this so that this information is available for us to be continued to, for the scientists and the researchers to continue to understand how the vaccine rollout is happening. We appeal to those who have made the choice to not to vaccinate as well, to respect the right of those who have made the choice to vaccinate. Please, we want to say to you, as you make your choice, respect the democratic rights of others who want to vaccinate. Today, we are joined by Professor Brenda Gray, who is the CEO of the South African Medical Research Council, one of our top researchers in the country, who will share more details about the side effects of vaccines and what people can expect after taking the vaccine. I cannot thank healthcare workers enough, doctors, nurses, all other supporting staff in the healthcare center, for continue to be in the forefront of the fight against the COVID-19 pandemic. Even in circumstances where your lives were in, you've continued to stood up and make sure you continue to stand up and make sure that you provide the service, you render this service to the country with the most professional way, in the most professional way. And we continue to receive messages from many South Africans who thank you, who say that you have been a pillar of strength for them in the most difficult times. You have given hope to the most people who were at hopeless times during their difficulties. You stood up bravely and you continue to deliver the service to South Africans at a time when many of us would have rushed to attend to the safety of our own friends and families. I also want to thank South Africans who stood up to defend our democracy, economic infrastructure, and other very vulnerable South Africans. This is who we are as South Africans. In a time of difficulties, we stand together united in our diversity and defend our democracy. In the same way that we must continue to work together as South Africans, fight against the pandemic. Let me thank all those who have been complying with the regulations that are aimed at containing the spread of the virus, because in this way, you are also contributing in the fight. Thank you very much. Thank you.
Thank you very much, Minister, for that, for those remarks. And indeed, encourage people to ensure that they do get their issues in terms of testing and getting their medical records in check and being honest about it. Thank you, Minister. And we'll now move on to Professor Glenda Gray, who will be giving us more insight on that. And I'll hand over to you, Professor. Thank you.
Good morning. Can you see my screen? Is it showing?
Yes, we can see it.
Okay, thank you. Acting Minister of Health, Deputy Minister, DG, DDGs, all protocol observed. I'm going to speak a little bit about COVID vaccines and how we need to use vaccines to chase this virus to control the pandemic at a global level. As the acting minister has already told you, South Africa has had a devastating pandemic with 2.33 million cases already detected. Fortunately, it looks like we're starting to see a decline, which has been very marked in Gauteng, and we hope that the decline will continue and that we are able to control this third surge caused by the Delta variant. I also need to remind South Africa that since the beginning of the pandemic, we've had over 200,000 excess deaths that have been related to the pandemic since the beginning. And this just shows you the burden of disease that has occurred during this pandemic and how important it is for us to control the pandemic in South Africa. And I need to remind the South Africans that the only way to control this pandemic is via global immunization. Everybody does need to be vaccinated, not just 20% or 30%, but everybody. Already, 26.8% of the world's population has received at least one dose of the COVID-19 vaccine. And at least, so this accounts to about 3.71 billion doses. So there's a lot of information about the safety of these vaccines, given the fact that so many people in the world have received this vaccine. But I'll need to also remind South Africans that only 1.1% of people in low-income countries have received at least one dose, which means that we're far behind high-income countries, and we have to really speed up our pace of vaccination to make sure that our continent can be vaccinated in a rapid fashion. When you look at the balance between risk and benefit, overwhelmingly, I want to remind South Africans that the national rollout vaccines are safe and they're also effective, and that the risk benefit favors vaccination over not being vaccinated. There have been rare serious side effects that have been reported with the use of the vaccines, and we are using the Janssen J&J single jab and the Pfizer mRNA vaccine. And with the mRNA vaccine, myocarditis has been reported as a rare adverse event. And with the Janssen vaccine, we've heard before about the thrombosis with thrombocytopenia syndrome, and this was this we used to call VIT, vaccine-induced thrombotic thrombocytopenia, and this caused the Sasonke study to be halted for 2 weeks while we evaluated this serious adverse event and learned how to manage it. Also, just recently, we've heard about the Guillain-Barre Syndrome that's also been associated with these vaccines. But I want to also tell you that if you look at the rate per vaccination for these rare side effects, you can see the benefit of getting the vaccine is better. So if you look at the myocarditis for the Pfizer vaccine or the mRNA vaccine, it's about 3.5 cases per million doses among adults. If you look at the Janssen vaccine, in terms of the TTS, it's about 3 cases per million doses among adults. And the Guillain-Barre is about 7.8 cases per million doses among adults. And they obviously, depending on the age and sex, the risk may vary. If we have to just explain a little bit more about the Guillain-Barre syndrome that we've just heard about recently, this is a rare neurological disorder. The cause is unknown. It usually occurs after an infection, and it's been associated with getting it after flu, getting it after hepatitis B or C, and even COVID-19 itself has been associated with Guillain-Barre syndrome. Vaccination, other vaccinations have also been associated with Guillain-Barre syndrome, like the influenza vaccine and like other childhood vaccines. And this does cause muscle weakness, and usually you feel tingling in your legs and weakness in your legs, and you may have difficulty going upstairs. If this does happen, it's important for you to seek medical care, because you can manage it. The risk for GBS is always highest in males and people over 50 years of age. So it's very important for us to make sure we manage it. Very little, we think in terms of the background Guillain-Barre occurring in the population is about 1 in 100,000. And so you need to also look at the background data on Guillain-Barre syndrome to understand whether it's increased or decreased in your setting or in your country. This is a very busy slide, but I thought it's very important to take you through this. We know that both vaccines, the Pfizer vaccine and the J&J vaccine, prevent hospitalization, prevent ICU, and prevent death. And so I'm just going to just show you, and you can see this is by age group, and maybe we'll concentrate on the 50 and above on both sides, I mean males and females. So on the right side of the tables, you can see Guillain-Barre syndrome and the thrombocytopenia for the Janssen vaccine, and on the Pfizer side, you can see the myocarditis cases. So we estimate that in the over 65-year-olds, in women, there may be 8 to 10 cases of Guillain-Barre syndrome, but at the same time, the vaccination will prevent 5,900 hospitalizations, 1,250 ICU admissions, and 840 deaths. In men, the Guillain-Barre syndrome may cause 7 to 8. For every million vaccines given, you may get 7 to 8 Guillain-Barre syndromes in people over 65. However, the vaccine will prevent, for every million doses given, 11,800 hospitalizations, 3,300 ICU admissions, and 2,300 deaths. If we look at the myocarditis cases for Pfizer, if you take the over 65-year-olds, there will be less than 1 case in women, and we will then, for 1 million doses of vaccine given, and for those million doses of vaccines given, we will prevent 6,200 hospitalizations, 1,300 ICU admissions, and 900 deaths. Similarly, for the older over 65s, less than 1 case of myocarditis, 12,000 hospitalizations averted, 3,500 ICU admissions averted, and 2,400 deaths. This was presented yesterday at the CDC's Advisory Committee on Immunization Practices, and overwhelmingly in the US, and the recommendation is that these vaccines, the risk-benefit ratio is in the favor of vaccines. So these are the rare side effects that you may see with both the J&J and the mRNA vaccines. The other side effects that the acting Minister of Health mentioned are immediately after vaccination. You may feel pain and swelling on your arm. You may have a fever. You may feel fatigue, tired, headache, and generally ill. And usually this resolves after a few days. If you feel that you are having side effects or that you're not feeling well after your vaccination, it's very important that you contact your healthcare provider or you contact your clinic, and you also report all these events to the Department of Health and to the NICD toll-free line. We heard last night also that SAHPRA has reported 28 deaths that have been reported to them following vaccination, and 4 have been associated with the Janssen, and 24 have been associated with the Pfizer vaccine. These deaths will always be evaluated. We need to see why the people died, when they died, what they died of, and whether this could be attributed to the vaccine or not. So it's a very important for all family members and healthcare workers to report these cases, so that the regulatory authorities and the Department of Health are able to investigate these and to try and see what is happening. But I just want to remind you again, billions of doses of these vaccines have been given globally, and we don't expect South Africans to behave differently to anywhere else in the world. So what about the long-term side effects? We also hear people are saying that they're going to be long-term side effects. So I just want to just say that serious side effects that cause long-term health problems are extremely unlikely following any vaccination, including COVID-19 vaccination. And we know that vaccine monitoring has shown that side effects generally happen within the first 6 weeks after receiving a vaccine dose, and so unlikely to happen after 6 weeks. We know that millions of people have received COVID-19 vaccines and no long-term side effects have been detected. And globally, we will continue to monitor the safety of COVID-19 vaccines, and locally, all these side effects are being monitored by SAHPRA, and the manufacturers have to submit a risk management plan to the regulatory authorities to ensure the ongoing pharmacovigilance of the vaccines. And so if we do find a connection between a safety issue and a vaccine, we work with the regulators and the vaccine manufacturers to find an appropriate solution to address the specific safety concern, like what we did with the thrombotic thrombocytopenia syndrome, and now just recently with the Guillain-Barre syndrome. So I want to just also reaffirm, as you've seen, that COVID-19 vaccines do reduce the risk of dying and hospitalization from COVID-19. And just to show you some data from across the world, this is Public Health England showing the decline in deaths in old people once the vaccination program started, again reaffirming the marked impact that vaccinations have on deaths. And this is just from December 2020 to March 2021. In terms of the effectiveness of COVID-19 vaccines in South Africa, I want to reaffirm that we know that these vaccines work, and they work against the Delta variant. Looking at our data from Sisonke, which was the study which was conducted in healthcare workers, we are looking at, we've closed the database and are doing some preliminary analysis, and we will be showing very soon that the vaccine is effective and does reduce your risk of severe disease, hospitalization, and death. And we have this evidence that this vaccine is effective in the Delta variant, with the Delta variant of concern in South Africa. And again, just a few weeks ago, I did show data from Harvard that demonstrated the immune responses from the single-dose vaccine are long-lasting, even up to 8 months, and demonstrating that the boost is not needed at this stage. We are hearing reports that people want a boost, and we have heard reports that the J&J vaccine doesn't work against the Delta variant from an in vitro lab study conducted in the US. So we want to tell you from South Africa, from our experience, that we have evidence locally that our vaccine works against the Delta variant. Very soon, probably at the end of August, we'll have data on the 2-dose J&J study, and we will also be able to tell you about the long-term durability of the single-dose J&J study very, very soon. This is just to remind you that the single-dose J&J vaccine is active against both the Delta and Beta variant of concern, and even up to 8 months after receiving one shot of the vaccine. So just to again reassure South Africans that these vaccines are working against the Delta vaccine. In terms of the Pfizer, we also know that across the world, the Pfizer vaccine is still found to be effective against the Delta variant. And local data from South Africa is emerging that is confirming that the Pfizer is effective, and there will be preliminary data available from evaluations conducted through the medical aid schemes. Just to tell you, if you look at Canada again, just to reassure you that whatever vaccine you're using in Canada, the Pfizer, Moderna, or AstraZeneca has been found to be effective with preventing symptomatic infection and severe outcomes around 80 to 90%. And full vaccination with the Pfizer increased protection against Delta, around 87% against symptomatic infections. So these data suggest that the vaccines are doing even better than previous studies suggested. If you look at Israel, although they've had an uptick of infections related to Delta, we're still seeing Pfizer effectiveness. There was a slight decline in preventing infection and symptomatic infection from 94 to 64%, and in preventing hospitalizations and death from 97 to 93%. So showing that this vaccine is still working against the Delta variant. Again, in the UK, I'm still seeing, looking at the AstraZeneca or the Pfizer vaccine, at a mild drop, but still effective against the Delta variant. And very important to show this, that the vaccines that we've got in our portfolio are still maintaining their effectiveness. So just in conclusion, I want to reassure South Africa that the risk-benefit ratio is in favor of the COVID-19 vaccines. We've had a terrible pandemic. We've had terrible excess death. We've lost all our loved ones. We've lost loved ones and our friends and colleagues. And so we do need to ensure that we try use our vaccination strategy to control the pandemic in South Africa. I want to also reassure that there is very good regulatory oversight in South Africa, and this is imperative to ascertain the ongoing safety of COVID vaccines in South Africa, and that our current portfolio of vaccines used in South Africa have demonstrated safety globally, and we are accumulating data locally as well, and that there is global and local effectiveness of the current COVID-19 vaccines that have been rolled out in South Africa. So I'm going to stop sharing there and allow for the next speaker to come on. Thank you very much.
Thank you so much, Professor Glenda Gray. Our next speaker is going to be Mr. Martin Kingston, who's representing Business for South Africa. You can go ahead, Mr. Kingston. Thank you.
Thank you, Hlengiwe. I hope that my slides are showing. Okay, so thank you very much. Good morning to everybody. Good morning, Minister, Deputy Minister, Director General. I really would like to emphasize the point that Professor Gray has just made, which is the incontrovertible evidence as to the effectiveness of the vaccines. And the only way that we're going to be able to roll that out quickly is through the public-private partnerships being formed under the oversight of the Department of Health on an integrated basis. As the Minister has said, we've been working together with the National Department of Health now and other arms of government for most of the past 6 months. And the momentum that's been achieved is nothing short of extraordinary. We've seen 6 million vaccinations administered to date, the majority, of course, under the mass vaccination program. This slide shows the structure that's in place between government and Business for South Africa, the Joint Strategic Oversight Committee, which is chaired by the Director General, Sandile Buthelezi, involving not just NDOH officials, but also those from National Treasury and Presidency. And you can see that there are 5 work streams. I won't go through them in detail, which are effectively now joint work streams working on finance and funding flows, information and data management, the service delivery platforms, making sure that we're able to both acquire and then distribute the vaccine, and ultimately stakeholder engagement, communication and advocacy. It's meeting twice a week. At the peak of the program, it was meeting actually daily, and it's proved to be a very effective mechanism for addressing issues, and indeed for business as a partner to government to be able to discuss policy and how best to achieve the objective, as we say at the bottom of the slide, of accelerating the time frame within which we can vaccinate the entire population down to 1 year. And now we're doing that on a fully integrated basis across uninsured and insured, as well as public and private sites, to optimize the program. I want to just talk a little bit about how quickly that ramp up is now taking place and the role that the private sector is playing. So at the top of this slide, we talk about jabs per day. This is as of yesterday, and as you heard the minister say, we're at the moment at between 225 and 240,000 jabs a day, but I'm going to show how that's moving up, split in the private sector between 4 primary groupings or distribution platforms: the hospitals, the dark blue shows those that are online, and the lighter blue, those that are already in the system and coming online, being operationalized, having gone through the curation, registration and licensing process. Non-healthcare establishments that have been put up by, for example, medical scheme providers, pharmacies, as you can see, the most significant proportion at the moment coming from private pharmacies, including independent pharmacies, occupational health and safety, but that, as far as we're concerned, is workplace sites now already vaccinating 25,000 jabs a day, but we think that we can ramp that up very quickly to 45,000 ramps a day. There are already 57 workplace sites, large workplace sites capable of administering over 4,000 jabs per day that have been operationalized. So you can see that in the private sector alone, already there's 121,000 jabs a day of capacity, with another nearly 100,000, 93,000 in the pipeline to complement and add to the public sector capacity that's already in the system of 205,000 jabs a day. So you can see that although we're administering up to 240,000, we actually have the capacity as a country now to administer already over 320,000, moving with those that are coming online. And we say coming online is awaiting permits, those that are already far advanced in the system, taking us to 420,000. This excludes, and you can see on the right-hand side of the slide, public sites, public sector cohorts and mobile sites, as well as surge sites. For example, the work that we've been doing with SASA. We had a proof of concept on the 6th and 7th of July. We're now going to repeat that in August. We expect to be able to do 100,000 a day in August, so 400,000 simply in respect of those mobile surge capacity sites. If we look at the top of this slide, you can see how very successful the country has been now in ramping up the overall speed of the vaccination program. You can see where my cursor is, the 5th of July. This is J&J and the first dose of Pfizer. And then if you look at the bubble at the top, that was 168,000 jabs that was being administered per day. But you can now see that if we go to where we are now, we're already at 227,000. And we believe that now we have effectively access to adequate amounts of vaccine going into August and September, that we will break through the 300,000 target that the minister talked about and reach 420,000. We think we should be at 420,000 vaccines a day across the public and the private sector by September, if you like, steady state. That will enable us effectively to administer first doses, some 35 million first doses, as people will have heard Dr. Crisp say, by the end of this year. We think that that means that 50% of the over 35-year-olds should have received their first dose by the end of August. All of this, by the way, is going to have been facilitated and indeed accelerated by the announcements that the minister has already made about being able to move ahead across a number of areas, including sectors, as quickly as possible. I just want to talk a little bit about the impact of the violence and unrest on the rollout program. Despite the fact that it obviously was a huge interruption to the vaccination program, we're now back on track. I have to emphasize, due to collaboration with all arms of government, NGOH, but also the security establishment as well. If we go from the left-hand side of the slide, obviously wholesalers and distributors were significantly affected. There were no deliveries for a week. but in agreement with NGOH, the vaccine deliveries that were scheduled for KZN were reallocated to other provinces where they could be effectively utilized. 120 or so pharmacies that were closed, looted, or burned, including 71 vaccination sites. More than half of those we anticipate being back online by the beginning of August, and we're seeing many of these pharmacies working together to see how we can optimize and continue the vaccine rollout. We are having daily calls, in fact, twice daily calls with the security services to ensure that we can bring the necessary medicines and oxygen from Gauteng down to KZN, as well as making sure that there's protection around key distribution points such as warehouses and oxygen manufacturers. Obviously, there are longer term challenges, but once again, we're fully committed to seeing how we can work across business with government to repair that damage and restabilize the situation as quickly as possible. Finally, if I can just re-emphasize that it has been this partnership which has enabled us to see this very aggressive and accelerated rollout of the vaccination program, which will be amplified by the announcements that the Minister has made. We are fully committed to seeing how we can do that as quickly as possible on a fully integrated basis across public and private, insured and uninsured. With that, I shall take my screen down. Thank you very much indeed for inviting us to present.
Thank you very much, Mr. Kingston, for that very exciting presentation. Indeed, it is encouraging that we may have a situation where we're even exceeding the 300 mark, that is 300,000 mark that has been set by the president. So that's very great news as we ramp up and get people who want to be vaccinated. Thank you so much. And I will now move on to our Director General, Dr. Buthelezi, who's going to take us through some of the max vaccine sites and other information that is very crucial at this stage, so that you can actually see how government working with the private sector is actually ramping up in terms of this. Thank you so much.
Thank you very much. Thank you. Okay, thank you very much, and thank you, Minister, Deputy Minister, and colleagues. Mine will be very easy, just to amplify the message on the mass sites, which the Minister has already referred to, and Martin as well. Well, the mass sites is also one of the good partnerships that we have with the Solidarity Fund, which is really going to be an extended platform in addition to what we are already using to roll out the vaccination. What we will do with the Solidarity Fund is that we will be appointing a number of clinical operators who will work as essentially roving teams to ensure that they operate those sites whilst the other existing sites continue to function. And then we'll then work with our provincial colleagues, obviously, as the Minister has mentioned, based on the density, the geography, and the traffic in those areas, to ensure that those sites are selected, and then the clinical operators will then move in. We already have proposals of the areas where these sites are going to be developed in different provinces. And we've actually worked out an operating and financial model together with the Solidarity Fund, and they will assist with funding the setup cost and the operational cost of these such capacity sites. And these sites will work in three different ways. One will be the fixed outreach sites, which will be called mass vaccination sites. And these already are modeled around what is already existing. We know that in Western Cape, we have City ICC and Athlone Stadium. Please pardon the spelling. And in KZN, we already have Moses Mabhida Stadium and Royal Showgrounds. And in Gauteng, we already have Chris Hani Baragwanath Academic Hospital, where we also have a mass site. So we want to do additional sites to this in the different areas, so that we ensure that there is equitable coverage of the population as we move around. But in addition to that, as Martin has mentioned, we'll be doing some temporary outreach sites, which will be like what we're doing with social services, which is SASSA, which is a key initiative, which I'm going to spend a bit of time on. And then the other new modality that we're going to use is using the roving teams. Now, what these roving teams are going to be doing, they will be going into an area using existing buildings, for example, the community halls. They will get into an area, and do mass vaccinations. When they've done with that area, they move to the next area. They do mass vaccinations. They work there for a number of days, and then once they've covered most of that area, they move to the other area. This is to ensure that we bring the vaccine to the people, but not for the people to go to the vaccines. The time frame is that we'd like to start on the August the 1st and up to until January, so that we are able to ramp up rapidly. And most of these sites, we're looking at doing more than 1,000 vaccinations per day in each of the sites. And our target is that we'd reach millions coming from these sites, in addition to what we are currently doing. With the good work that we've been doing with SASSA, as Martin has mentioned, we've modeled on the 6th and the 7th of July in 5 provinces, and we used 13 retailers and 1 SA post office. And at least in 6 of these sites, we discovered that we can get more numbers as compared to the nearest public health facility that is next to the site. And most of these are operated either by provincial DOH, by an NGO, or by the private sector. And we've also done just a SNAP survey in a number of these sites, and we've learned a lot, which is assisting us to actually model these sites and also model our overall vaccination program. And we saw that, for example, some of the people, 30% would vaccinate on the day, and we discovered that 40% of the people in those pay points had already been vaccinated. We still have 30%, which is worrying us. We preferred not to be vaccinated. And we had less than 13% were worried about the safety and the side effects, as had been covered by Professor Glenda Gray. So a lot of people felt that it was a good idea for us to actually do this vaccination at the SASSA pay point, just to, as they mostly go there and they prefer that it is a site that they would like to go to. But also for us is to target the over 60 that we've missed out, to ensure that we cover as many as possible, especially those who access the social security grants. We are going to be scaling up this program, and the target, as Martin has mentioned, over the 4 days in August, we really want to do about 100,000 per day in these sites, totaling 400,000. If we can do more, much the better. But we know that a number of our people still prefer to go to the SASSA pay points. And here we will be able to mop up the over 60 that we've missed up. Again, it's still a combination of public and private providers, and also working with retailers who are involved in the SASSA grants. And we are actually managing this program jointly between ourselves, the Department of Social Development, SASSA, Medical Research Council, the Solidarity Fund, and B4SA. So these are the partners that are involved. We're not advertising them, but we want to thank them for being part of this to ensure that we reach out to all the South Africans. Thank you very much. I'll stop there.
Siyabonga DG for that presentation. We are now going to request Ms. Melanie Wolmarans to just give us a sense of how we're moving in terms of the scheduling. We have an alternative scheduling. She'll be taking us through that one. Thanks, Ms. Melanie.
Good morning, and good morning, Minister and Deputy Minister, DG, and colleagues. So my task is just to do the announcements in terms of the new developments on the electronic vaccination data system. First, I just on the screen currently, I just want to confirm that you can see my screen.
Yes, we can see the screen.
So if you log on to the portal, as Minister has announced, the portal has now been translated. And so on the corner, you will see there's English. And then if you go down, you can select Afrikaans, and it's been translated into Afrikaans. It's also been translated into Sesotho, translated in isiXhosa, and also translated into isiZulu. This registration is then, translation is available on both the WhatsApp, the web registration, as well as the WhatsApp registration, as well as on the USSD platform for registration. And this is just making it more accessible for the general population in order to be able to register on the system. The next is just to talk about the booking system that is currently under development. I just want to share my screen again. So over the past few months, we did quite a lot of discussion with different stakeholder groups, looking at how the EVDS can, especially as it refers to the scheduling or the booking system, how it can be adopted so that it makes it more functional and easier to use by our public. One of the key areas that we have identified, as Minister has indicated, is the frustrations that some of our population are experiencing around the automated centralized booking system. Just to announce that based on our analysis, there's 80% of the population that are being scheduled through the scheduling system are currently accessing their vaccination as per the schedule. However, as we move in the vaccination program, we're getting more stability on the service delivery platform with more vaccination sites that's coming on board, and also with a higher demand of individuals that opt in to receive the vaccination. We are looking at how can we improve the choice of individuals in order to be able to select the site and also select the time slot in terms of the for them to access the vaccination. So we're talking about a complementary vaccination appointment scheduling that we can put on offer in addition to the existing NDOH EVDS scheduling system. This will be particularly for the population that has got access to digital platforms in order to be able to log in and then choose the vaccination site as well as a time for vaccination. So currently we've got a limited number of third-party organizations that currently are indirectly accessing vaccination codes and schedule individuals. So it's a limited number of people that has got that choice. So it does create some disruption and conflict at the site level where we see overbookings and sometimes people have to be turned away. It also fragments the supply planning in order to make sure that when people are arriving at the vaccination site, that enough vaccines are available so that everybody that arrives on that day can be receiving their vaccination. And then in terms of equitable access, allows individuals that has got the digital means to actually making a booking. The high-level workflow will be individuals will continue to register on the EVDS. We issue them with a vaccination code, and then they would then log onto a booking system where they then can choose a date and a time and as well as a site for vaccination. Once their booking is secured, then on the automated system, it will be disabled to indicate that they've already been scheduled, and then the person goes through the process of the capturing of the vaccination on the EVDS, and once they have been vaccinated, the system will send them an SMS to confirm their vaccination, and they will go back into the queue if it is a multi-dose vaccine. So this is currently in development. It's quite a big change in terms of the technology. We are looking at doing the UAT, the user acceptance testing, with the different stakeholders towards the end of next week, and it should be ready to go live if everything goes to plan. With technology, you never know, but if everything goes to plan, it should be available towards the end, first week, the end of the first week of August. Once it is available, we will make a user manual available and widely communicate in terms of how people can access the new functionality that's being added to support the vaccination program. Thank you.
All right, thank you, Ms. Wolmarans for that presentation, and I think it assists us a lot, as we know that a lot of concerns have been raised around issues of not receiving SMSs. So we're hoping that that will tighten it up. So colleagues, thanks so much for that presentation, and we're going to now move on to our Q&A. Our chat is open, media colleagues. If you want to ask your questions, you can put them on chat. There's some questions here already. And for our question and answer session, we are actually having our Deputy Director Generals, Dr. Anban Pile and Dr. Nicholas Crespo, will be assisting our panel with those questions that may need their intervention. I think at this stage, I will go and pose the first question to the panelists. And I think we will then have to move from that point and do our closing remarks so that we also cover time and finish by 9. Our closing remarks by the Deputy Minister. So the first question I've received this morning is from Andile Morobe, who's saying, good morning, Minister. I see there's been an increase in the number of jabs per day, and the vaccine for 35 plus has been going well, even though it was supposed to start in August. Now, when can we expect registration and vaccine for the 30 to 34, for the cohort age 30 to 34, or those who are in fact below 34, Minister? I think that question is directed to the Minister. The second question that we've received is around the operating hours of vaccination sites. It's from Kennedy. Why aren't vaccine centers opening from 6 a.m. to 8 p.m.? And so I think that is just a suggestion from him that probably it's something to consider. The other question is from Pilani, who's asking about the effectiveness of vaccines, which Professor Gray has in fact elaborated quite extensively on. I will move to the next one from SK Lahama, who's basically asking about reports of people having died reportedly from taking the vaccine. This one is directed at Minister, DG, and everybody, but I think that we will then pass it on to the panelists to handle that one, especially because Professor Gray has actually touched on it extensively as well. So there's a question around the likeliness of people possibly dying from taking the vaccine, which has also dominated social media platforms. And then the other one is from Heidi at ENCA. Now the question from Heidi was also relating to the J&J vaccine. Let me just get to it quickly. So Heidi was asking, is there no way that the department can try and consider vaccinating those who aren't eligible at this stage, but have serious comorbidities? So the issue of comorbidities is still coming up there. And then she's saying that there's a serious concern that there are those who are left vulnerable unnecessarily because there is while there is a life-saving vaccine. And she's also asking the question around reports of deaths linked to the vaccine. And she's also asking about the latest on J&J Aspen plant. Thank you so much. I think we'll then allow our expert panels to start on to respond to those questions. Thanks. Maybe we can start with Professor Gray. You want to take that issue of just clarity again on the reported deaths?
Yeah, I mean, I think it's very important that we know when the person died, how soon after vaccination, whether the person died from COVID, intercurrent COVID, or whether the person had other comorbidities. It's also important to look at the background rate of certain conditions to ascertain whether there is an abnormal increase in deaths. And so I think it's very important for us to understand clearly people who get vaccinated, if there are deaths reported, they need to be investigated so we can try and ascertain causality. But again, at a global level, there haven't been any signals around these vaccines. You know, as I've mentioned before, billions of vaccines have been given, millions of the J&J and billions of the Pfizer. And at a global level, there's no safety signal regarding death. So I think we would need to see and investigate deaths that occur within 28 days of vaccination and try and ascertain the cause to see whether South Africa is reporting different levels, which is unlikely because there's very good reporting in Europe, in the UK, and in the USA. So it's unlikely that we're going to be seeing more deaths as compared to other countries that are reporting this and have lots of experience with vaccines. Over.
I think Tlengiwe is muted.
Tlengiwe? I
think we lost her.
Okay, let's ask, DG, you want to come in response, and Dr. Crisp on the issues?
Thank you very much. Thank you very much, Minister, and thank you for the questions. I think I want to touch on the issue of the operating hours. I think it's a good idea. We are actually aiming to ensure that the access is increased in all ways, be it on weekends, be it on extending working hours during the week, or any other modality that is possible. So as Tlengiwe has mentioned, I think that's one of the things that we're exploring. And I must say that in some of the provinces that do actually have extended hours in terms of that, because our issue is let's ensure that there's as much access as possible to the vaccine in the area. And then there's an issue of comorbidities. Yes, we do agree, but what we currently targeting is to ensure that we open as much as possible in terms of the age groups, which I'm not going to comment much on, as the minister might comment at the end, so that we cover as many people as possible. One of the issues about comorbidities who are more than 80 or are older than 18 years of age is actually the modality of proving those comorbidities at any case, and there are there's quite a varied number of comorbidities that are there. We do take that into consideration, but we believe that as soon as we've opened for everyone, it will be easier for everyone to access. But lastly, what I need to mention is that in terms of all the data that we have, age is still the single most highest contributor to morbidity and mortality as it relates to COVID. Hence, we moved on age as the first preference for us, and which is easier to manage in terms of the IT system. I will stop there, Minister, and hand back to Nicholas if he's got to add anything.
Thanks, DG. Nicholas?
Minister, good morning. Good morning, Deputy Minister and colleagues. Thanks. So perhaps just the one question that hasn't been answered. I won't go back to those that have been covered. There was a question asked about what is happening with the Johnson & Johnson vaccine. And we are pleased to say that in August, we are now going to have Johnson & Johnson vaccine back as a fundamental part of our program. And at the moment, we are still using the last of the Johnson & Johnson vaccine with a short expiry date, which is due to expire on the 11th of August. It's been allocated into programs and is being used now as an adjunct to our Pfizer vaccine. So that's really good news for us because it means that it's only a single dose. We are particularly targeting the use of the Johnson & Johnson vaccine to difficult to reach communities because they're far away or it's hard to access those people a second time. So if we can get them vaccinated with Johnson & Johnson vaccine, then it means we don't have to go back. So it will also be the vaccine of choice in the SASA program, which the DG and Martin Kingston have spoken about earlier, so that we can get to the elderly quickly and not have to vaccinate them again. Thank you, Minister.
Thank you very much. DM, you want to cover some questions, and then I'll close.
Just to add on what Professor Glenda Gray has said about the reports of deaths which are related to the vaccination. I would just want to emphasize that it's very important that families whose loved ones have died in one way or another associated with the vaccination, it's very important that those be reported to the nearest health facilities, and also, as mentioned, reported also on the NICD hotline system, so that what is important is that those deaths needs to be thoroughly investigated. We can say to members of the public that already there are a number of occasions where deaths have been reported associated with the vaccination, but when further investigation has been made, in a number of occasions it has been found that those citizens either had other ailments which could be attributed to as a cause of death, in a number of instances where it really caused quite a lot of anxiety. It was actually found that it was a situation where it could be traced that those citizens already had COVID, and in the history taking, it didn't come out very clearly. But because of the fact that other family members, showed up to who had not been vaccinated, showed up to be COVID positive, it could be quite clearly indicated that found that those citizens who passed away actually were undetected COVID before they got vaccinated. So this just adds to the importance of thorough reporting, so that these deaths can be thoroughly investigated, so that we don't sit with situations where our South Africans are quite anxious about the vaccines themselves causing death when these matters have not been thoroughly investigated. Thank you.
Thanks, Tim. Martin, is there anything you would want to respond to so that we close?
No, Minister, I think that all the questions have been properly responded to. Thanks, Minister.
Okay, thank you. Maybe just rounding up the questions and then allowing TM to be able to deal with. Firstly, around the questions on the next cohort. We are at the final stages in terms of the next cohort. As soon as we are ready, an announcement will be made. We are hoping in the coming week or so, it could be even days. We are hoping that some announcements will come through. I would not go into detail, but safe to say that will respond to the issue of the comorbidities. And we're not looking at 30 plus, we're looking at 18 plus. We've looked at our population. So we saw that with the 60 plus, we had about 5.5 million, almost around there. And then we had 50 plus where we were sitting at about 4 million, and then 5 plus. But because we've been vaccinating as well in terms of sectors, so some of these numbers, you find that when you go to that age category, you'll find them having vaccinated. Together again, when you go to the sectors as well, for example, when we were in correctional services, those who were 60 plus, those who were 50 plus were already vaccinated. So it reduces the number. So as we consolidate, we realize that we can be able to push in terms of the numbers as well. So as we do believe that the age cohort operation or vaccination strategy seem to work better. It's able to get people to move faster. And with the self-registration now, self-registration and self-scheduling, where a person will go on the site and say, I want to go based on maybe my work, closer to my work or closer to my home, vaccinate on this day based on the schedule and dates available I can select. We believe that this becomes an efficient way of vaccinating and will get us moving faster in terms of the numbers that we do. What we will do in the next briefing, perhaps next week, will bring CSIR to come and share, because they've already done a model that shows at what pace will we be able to get the target numbers that we are looking for. Currently, we are seeing ourselves coming forward from the February 2022 to almost around December, but we'll allow them to share so that the public can see that what we are doing is also tested and also verified by those outside the Department of Health, who can be able to say we've used models and this is what can be achieved. So we're utilizing that. There's a question around vaccine supply side, availability side, we continue to say this is what we've got. We've got, yes, I think Mia asked this, we've got the schedule. We've got scheduled delivery for the 26th of July, which is almost around 1.4 million of J&J, 968,000 of Pfizer. But we also have, remember, the COVAX donation that we've received, as well expected on the 26th of July almost. And remember, these are estimates, so we work closer to the dates. Either they can be before or after 2 days, so almost around those dates. And then again on August, just to indicate, we're expecting almost around 1.5 million and 619 in terms of Pfizer and J&J. So those are the I'll just explain for now these two because they are closer in terms of dates, just to give comfort that we are able to. I do note the feedback that we need to start sharing publicly in terms of vaccine acquisition as well. There's quite a lot of work that has been done in terms of what we want to see in partnership, working together with everyone that needs to work to in terms of vaccine acquisition program. There are interventions. We are not yet ready to announce, so we'll announce those changes or possibly the issues around as soon as possible when we are ready as government. We'll finalize and make those public announcements. Lastly, around somebody asked about Minister Ntshavheni saying that there is an NCCC on Sunday. Yes, there is an NCCC on Sunday scheduled. So we'll present our recommendation. As the norm, we normally don't discuss what we are taking to NCCC because then it just defeats the purpose. So we will look as Department of Health, make recommendations following what we have received from MEC. As I said earlier at the beginning of the week, I said MEC has promised to make recommendations. We have received those recommendations from MEC. We'll compile a report that will be processed through NetJoint. NetJoint, where it sits, it looks at what health brings, it looks at what economic cluster brings, it looks at what security cluster brings, and social cluster brings. So there are 4 clusters that presents, but we present as health from the recommendation that we get. Out of that, a consolidated recommendation is taken and it's put together and is taken to NCCC. Out of NCCC then would go to PCC, Presidential NCCC's National Command Coronavirus Council. From there, we'll go to Presidential Coordinating Council, which comprises of the President, the ministers, the premiers, the MECs in the provinces responsible for local government, and also MECs responsible for health, local government representatives, SALGA, and traditional leaders representatives. So we present there, and then out of that, the recommendation and their inputs are coordinated and taken to cabinet for a final decision. And should there be a need for president to address, that culminates to what president announces on that day, or you see the changes in terms of the regulation. So it's important for us to constantly remind the public on what these processes, because they have been adapted, they've been established, and they're working. And we do not want as health to be seen breaking those protocols and the processes that have been put in place. So I hope, thank you, I've been able to answer all questions that were remaining as we work towards wrapping up. So I do know that many have been edgy to say, please, Minister, open for they are calling themselves the Mandela generation, Boom Shaka. So we'll see when they come up, what is it that they are able to give us. But we are hopeful that many South Africans, we are grateful that many South Africans have heeded the call. We'll continue to share this information on our website, on our social media platform for those who have missed the briefing. Thank you very much. Thank you.
Thank you for that, Minister. Perhaps, Minister, the one commonly asked question is around the registration of homeless people or undocumented people, perhaps. If we can clarify that issue of when I don't have the documentation or a South African ID or I'm homeless, how do I make sure that I also get registered?
Okay, with the homeless, we'd be able to utilize social development around that. I'm not so sure. We'll have to get guidance in terms of the unregistered, because we're dealing within the government systems and provision of services. We follow the laws of the country. So you have to be a documented person in the country. If you are undocumented, it means you are illegal in the country. So it's a different case. We have responsibility to those that are known to the state by the state. Thank you very much.
Thanks for that clarity, Minister. Thank you so much. DM is going to come in and close for us as we are definitely running out of time. So after DM, we'll then bring our press conference to a close. Deputy Minister, please do go ahead. Thank you.
Thank you very much. Thank you. Again, greetings to colleague Minister Kubai, the panelists, Prof. Glenda Gray, Mr. Martin Kingston, and the team from Health led by the DG, Melanie Balmarans, Dr. Nicholas Crisp, and Anban. Let me again take this opportunity to express our appreciation to the health workers of our country for the admirable work that they continue to do, saving the lives of thousands of South Africans from this deadly COVID-19 pandemic and many other ailments afflicting our people. Let us remind ourselves that indeed, as we deal with this pandemic, the other quadruple burden of disease still remains. And as we always urge people to continue to use our health facilities to receive other services for non-communicable diseases and also for other chronic infectious disease, such as HIV and AIDS and tuberculosis. We know that the last few weeks have been very difficult as more and more people have descended on our public and also private health facilities in disparate need for assistance. While we mourn the loss of many lives, many loved ones, hundreds of our compatriots who have passed away, we are comforted by the knowledge that without the dedication of our women and men in the health front line, many more people would have lost their lives. We are encouraged by the steady declining numbers of daily infections as already presented by Minister and also by Professor Glenda Gray. This gives us hope that sooner rather than later, the worst will be behind us. We are encouraged by the fact that Gauteng, the epicenter of this third wave, but also the most populous province in our country, which has actually borne the brunt of this third wave, did not get completely overwhelmed. We are encouraged by the declining numbers from the highs of 16,000 in 24 hours in Gauteng to the current numbers where we are hovering between 4,000 and 5,000. It's still a big number, but really very encouraged by the decline because it says to us that our health facilities will be given breathing space. And we're pleased that even at the peak of this third wave, Gauteng province was not completely overwhelmed by the hospital admissions. We will continue to support the other 8 provinces as the third wave resurgence spreads to them. We know that this is the trend, that this third wave, just like the first and second wave, started in one province and then spread into the others. The trend is quite clear. We can already see that there is a rise of the spike in the Western Cape already, high numbers in the Western Cape, Limpopo province. The Northwest is also showing those signs, and also KwaZulu-Natal. We expect, especially after these disturbances with a lot of crowds, we expect that the numbers are going to be rising. So we're watching that and working closely with our colleagues to give them support in various ways, in the same way as we've supported Gauteng in various ways. We are also encouraged by the fact that as the new infections are stabilizing, we are in a position to ramp up vaccinations as already reported. The fact that we are already in the areas of 250,000, approaching some days, 270,000, very close to reaching the President's task of us reaching 300,000 vaccinations per day. We are very close to that. So this is pleasing, and we are hoping that as the third wave declines, we'll get even more opportunity to vaccinate more and more people so that we can avoid a big fourth wave, which we don't know when it might be coming. We are getting more confident that the early days of frustration with the instability of supply of vaccination is behind us. We are more comfortable with the supply in the months and in the weeks and months coming forward. We are very comfortable that we will be able to get stability with the supply of vaccines. We urge South Africans not to be rattled by the doomsayers who continue to spread false news about the safety of the vaccines, as already presented by Professor Glenda Gray. Again, let us emphasize that we have very rigorous systems of our regulatory system, regulatory processes through SAPRA, our regulator, which validates the safety and efficacy of our vaccines. So, and this is the very reason why we are very committed to do everything possible to safeguard the independence of the regulator.
Well, at the end of what is the Q&A session, just the final few comments from Dr. Joe Pantler, also the acting health minister, as well. Just very briefly, some of the key points coming out of today. A lot of people asking about the number of vaccines that were destroyed during the looting and the violence. We now have a number, 47,500 vaccines destroyed during the looting and unrest.
Indeed, we took note of those pharmacies that were also looted. I suppose even though they backtrack the rollout, they'll promise to do what they can. But we'll leave it there, and Nicholas will continue with this discussion from 9 o'clock.
That's right. Stay warm, stay inside, stay safe. We'll see you Monday. Bye-bye.
We urge everybody to take up the opportunity. All provinces are opening up for more sites, including mobile outreach and mass sites as presented by the Director General. As we can see in other parts of the world, vaccination is our best hope of getting closer to normal social and economic activity. For those few cases where adverse effects have been experienced, as we said earlier on, please make sure that you report to the nearest health facility so that you can be well attended. I wish to also remind all South Africans who have received the Pfizer vaccine, which is the one which we have been using in the most for the general population, excluding the healthcare workers, the educators, and now the security forces, that after 42 days, you need to get your second jab. Even if there can be a hiccup that you don't receive your SMS, once you've got your card, you know when you are vaccinated. And when the 42 days approach, when you reach the 42 days, if you haven't received a message, please approach your nearest vaccination site for the second jab. If it is not convenient to go back to the site where you got your first jab, you can approach the nearest vaccination site so that you can be assisted. Let me also just remind every one of us that while we're getting the vaccination, this is not the time to let down our guards. We must continue to use the non-pharmaceutical interventions, tried and tested, avoiding crowded places, keep a distance, wash your hands and sanitize, and wear our masks whenever we leave our homes. We believe that indeed, if we all work together, we can be able to defeat this invisible enemy. Thank you very much.
Thank you for that, Deputy Minister. I think we're just gonna give it a close now. Thanks so much, South Africans, for tuning in this morning. Thank you to our panelists for always their willingness to always coming through and joining us for these weekly briefings. And we will hopefully see you next week. Thank you so much, everybody.
Thanks, Kengiwe. Bye-bye, everyone.